The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I have Virginie Lacoste with me. She is a speech and language pathologist, pediatric feeding and swallowing therapist, and an orofacial myofunctional therapist. Try to say that real fast. And she works here in the Austin area. She really works with a lot of post-NICU care to medically fragile infants, helps with people after they've had their tongue tie release surgeries. And she is just so awesome at helping parents get through all of the things with sucking and bottle feeding and breastfeeding. And I am so happy to have you here today to talk about thumb sucking and pacifiers.
Yes, thank you so much for having me.
Yeah, you're welcome. So Virginie and I met quite a long time ago, a number of years ago at some little networking events in Austin, kept running into each other. And I've always just enjoyed you so much. And I just think that the way that you deliver information is just bite-sized pieces and so understandable for people. I remember thinking, why would someone need a speech-language pathologist for a baby? The baby's not talking. And so it was kind of funny when we got to have that conversation. So can you tell us what in the world a speech and language pathologist does, especially when it comes to early childhood?
Yes, absolutely. Well, also when we met, our vibe was just perfect together. So I'm so glad we're doing this. So specifically for passies, thumb sucking, those early months, infants, again, before language, SLPs are like baby mouth coaches. So there's so many more things that babies do with the mouth. So related to feeding, swallowing, the oral mouth posture at rest, which we're going to talk about a lot today. What that is what the mouth is doing when it's not cooing, feeding. What does that look like at rest? And what we want to see. And then the SLP's role is to flag some of the items that could be harmful-ish to the oral development of babies and try to find alternative to them. And then not all SLPs are trained in feeding, swallowing, and myo. So you really have to dig in and find them. In Austin, we're a few. So I really love the community here and what we've built and what we agree on. And let me see. Yeah, we're looking at the function of the tongue.
Yeah.
So
I think that something is, I don't know, maybe this is right, maybe it's wrong, but the way I look at it is kind of like physical therapists, not all physical therapists know about pelvic floor, right? So not all physical therapists can do pelvic floor PT. So not all SLPs deal with the feeding and the swallowing and all of that. So when it comes specifically to pacifiers, which pacifiers can get a pretty bad rap, sometimes, but then also people will say, well, it's good to have a pacifier because it helps prevent SIDS, or I don't want to be a human pacifier to my baby, or I don't breastfeed, so I can't be a human pacifier and I can't just feed the baby all day. So what are your kind of pros and cons from the SLP perspective of pacifiers?
Yes. So I like to break it down in three different moments, in three different ages for the pros and cons of passies. So we have the first few days and weeks of life and how they can be used as a tool and how they can not be helpful. Then we have the middle window, the 3 to 5 months. And again, the pros and cons there, and the weaning window that I like to start at months 5 and 6. And then beyond the last window is the beyond 6 months up to like 5 years old plus. So, and that's the remediation window, hopefully. But there are I don't know which one you're getting most questions about, but there are
Let's start at the very beginning, because some
yes.
people are like, I'm never starting a pacifier. It's a bad habit. I'm never starting it. So pros and cons for the little bibbies. Let's go in order of age.
Perfect. So the first few weeks and days of life are about establishing that feeding on demand, bottle, breast, doesn't matter. It's about responding to baby's cues, baby's hunger cues that can be very subtle, and we're learning about them. So getting familiar with baby's hunger cues is super important. That lip smacking, rooting, fussing, hand to mouth movement those are all communication. And even they're not talking, they're communicating. But if the passy is in the mouth, you could be missing those cues. So we want to limit the use of passy to, even I have a 3-month-old and I was like, no passy, I don't need them. Let me try it the longest without them, which is for a challenge. And then, but there are inevitably moments where you need it in a pinch. So I'm preparing my setup for breastfeeding. I need 1 extra minute, passy in. No biggie. You're in the car, baby's crying. There's no other option, passy. So that sucking reflex is definitely helping them regulate. It stimulates the vagus nerve, and that's the parasympathetic system being so happy sucking on anything. And then let me see. So not having a passy will establish your mom's milk supply. It could stabilize baby's blood sugar because he's feeding more often, more regularly. But when you need it in a pinch, it's the perfect answer to the sucking reflex that wants to happen.
I think a lot of parents, I hear what they worry about is like, the pacifier is not the shape of my breast. So am I, their oral development, are they kind of orally developing a sucking pattern that is going to then not translate to the breast? Or do you think that it doesn't really matter?
I want to say, so it does matter a lot in long term, in frequency of use, in intensity of use, in prolonged use. So if it's the first 4 weeks and you pop in even a poorly shaped passy, and I'm an advocate for the less passy, the better. But even if it's just used as a tool, like for those minutes, it kind of doesn't matter. I have a bulbous one here. I have a cylinder shaped one here, and I have the Holy Grail mini here. And so if it's soothing baby and it helps that sucking, but the breast is given more frequently, or the right bottle shape is given frequently, then the sucking development will happen accordingly. It will happen well. It won't be destroyed by a passy if it's infrequent and sparing.
Okay. I do tell people usually, and this makes me feel better because you're kind of validating what advice I usually give. Good. I'm giving good advice, I think. I would say I know that you're saying, like, if a baby is hungry and you just need to use it for a second while you get something set up, of course, like, you're not going to miss any cues, whatever.
Please.
I generally say, like, just don't give a passy to a hungry baby, because they're using, even like for a long period of time, because they're giving so much energy to suck, and they're going to get really frustrated that they're still not getting the milk that they wanted. This isn't helping them. They're just getting more exhausted and more frustrated. But and I also say, soothe it and remove it. So if the baby is done, they're not hungry, but they just want to suck, I'll use it to soothe and then remove, so that they don't get dependent on it for sleep. Does that sound about kind of the advice that you're giving?
Precisely, yes. And the other use cases, those early days, are all the medical procedures, those heel pricks, the shots, circumcisions. The passy will be really useful there if the breast is not available, if a parent's pinky finger is not available, because like the clean pinky is absolutely great for sucking. It's the same. So for those specifically, then same. I feel the same as you do, where it's really helpful. It's a tool. So we think about it as a tool, not as a default. Yeah.
Yeah. And then what about that 2 to 5 month area that you talked about?
So something happens at the 3 to 4 month mark where the sucking reflex becomes voluntary. So before that, if you, with the touch of something, anything, an object to baby's palate or on top of baby's tongue, it will trigger the reflex, the sucking reflex. So baby doesn't need to be actively participating, boom, unless there's a nervous system issue or like neurological issue, which is something to address. Baby will suck. But then at that 3-4 month mark, there's a change that's happening. And then you want baby to build that skill of sucking. And so the passy can either support that or hinder that. And if you have the right passy at 3 to 4 month mark, then you can have that non-nutritive sucking training where you make sure that sucking is still going well. Because if it becomes weak, if it becomes discoordinated, then that could cause issues with breastfeeding, bottle feeding. So if you use one specific training passy that I have here, then it can be a helpful tool. It can help practice that sucking. And then the part where it hinders it at the 3 to 6 month mark, is when you have the passy in the mouth and it's taking the space of the tongue. So we want the tongue to be suctioned up to the palate at rest at all times. So my biggest takeaway of I have 3 takeaways, but one of them is the mouth posture at rest should be tongue suctioned up, lips sealed, and breathing through the nose. But if you have a passy in your mouth, it's taking up the space between the top of the tongue and the palate, but the tongue should be there. So if for too long, past that 6-month mark, or even if you have it too prolonged before that, then the tongue is not used to connecting and touching and getting familiar with that palate. And that's the most important thing for palate growth, palate width, development. And so that's where, okay, I need it. My baby's not sucking well. Let me do suck training on a non-nutritive object. But then if I use it too much, then it's not letting the tongue get up there.
This is so interesting to me, like just really so interesting to me, because I knew that thing about the tongue should be at rest up there, but I didn't realize it was, of course, that makes sense that it's helping shape the palate as well. And if your baby is so used to every time they're sleeping, or a lot of times when they're awake, some of them get addicted. Maybe my child, maybe not. I'm not going to guess she was very addicted. Then their palate is kind of growing like that. It's getting used to that. And that pacifier nipple is so much more narrow than their tongue would be holding that space. So then you see these kids that need these palate expanders and things like that because that is taking up that space. So that is just so interesting. It does make sense.
I'm so glad you mentioned the at night part, because that's a big thing I wanted to talk about. So if baby needs a passy to fall asleep, beautiful. There's sucking. That's a beautiful reflex under 6 months. And even if it's just for a few minutes, it helps them get comfy, cozy, beautiful. They pass out. Perfect. Remove it. If you see that baby needs the passy to sleep while they are sleeping, or thumb sucking while they are sleeping, they're not awake, and that would tell me as an SLP that baby needs that object, the thumb or the passy, to bridge the gap between the tongue and the palate. So if baby is constantly sucking on something while sleeping, then that means they need to, and that's an issue. So they could use it to fall asleep. That's a nice, soothing, beautiful comfort. They pass out. If they do it while they're sleeping, throughout the night, throughout the nap, then that's something different. That tells me that they can't bridge the gap between the tongue and the palate by themselves. Maybe the tongue doesn't reach up there. Maybe there's a tongue tie. Maybe the function. Maybe the tongue is weak, quote unquote. And so that's a different thing, and that would be a red flag to maybe call an SLP or.
Okay, this is so interesting, because I'm going to add a sleep consulting perspective here.
Yes.
So this makes sense. So what you're saying is, if your baby needs to suck, if you're watching your baby through a nap, let's say, and the whole time they're kind of sucking on that, and if it moves, they move it back. That was them being reliant on that. Now, as a sleep consultant, the way a baby wants, way a baby usually falls asleep the first time is the way they want to fall asleep the second time when their body wakes them up between sleep cycles. So if you hold your baby to fall asleep and then you put them down, when they have an in-between of sleep cycle, all of a sudden they wake up all the way because something changed because they're not being held. And they're like, wait, this isn't how I fall asleep. And they want you to do that again. So same thing with a pacifier. If it fell out and they were able to sleep through that sleep cycle, the issue wasn't that they have to have a pacifier to sleep. It's not the tongue and the palate issue. It's that they woke up between sleep cycles because they want to soothe themselves back to sleep. So those are two different things, but both, related.
Yes.
So for me, I'm like, if your baby is reliant on falling asleep with a pacifier, I don't love that. But as long as they can, I'm like, sprinkle a bunch of them around the crib so that they can pull it back and find it if they wake up, and they can put it back in. Because otherwise you're just a slave to putting a passy back in the mouth in between sleep cycles. So that's really cool because I never thought of it that way.
That's the perfect distinction between using it to fall asleep and using it to stay asleep or breathe. So it's a tool to breathe through their nose if they can't do it by themselves with the tongue up there. Yeah.
Okay. And then after 6 months, what do we think?
Okay. So that 5 to 6 month mark would be my favorite moment to focus more on chewing, babbling, introducing solids. So the pacifier stays with the pro for those soothing moments, transitions into naps, like you said, or sleep cycle. Beautiful. Perfect. And then the cons are, as the frequency of use climbs for patsies, then you're not focusing on the tongue doing all these other skills, gnawing on the hand, bringing toys to the mouth, bringing teethers to the mouth, practicing those chomping, and so there are many more skills I'd rather practice than use the passy as a default or as an activity during a wake window.
It's really funny. These kids, you think I'm just going to give it to them only when they're in the car seat or in the bed, like crib. And that was me. I'm only going to. And then she'd get hurt and she'd skin her little knee and she wanted her little passy. And I'd be like, okay, just for when you're hurt, like we just started adding it it was like her little best friend, and it was just her little anxiety reducer. And yes, she sure did have it until she was 5 years old when she got her tonsils out. And the only reason she wasn't allowed to have it is because you can't suck on something right after you got your tonsils out. Exactly. And I'm like, we broke the habit. Here we go. We're done. And then she healed and she's like, I want my passy back. And I was like, no, we're done. And she goes, I wasn't done. And I'm like, you have 2 more days with it, sis. Like, we've got to get off with the pacifier. She's 15. She remembers having a pacifier.
Wow.
I was like, whatever. She's not going to go to college with it. But then we did have teeth issues because she would walk around with it and she was talking through it. She had this little lisp because she had her passy all the time. So it was not ideal.
You're absolutely right. It's easy and it's working. Why would I not use it if it's working? Yeah. And we always say trust a mom's instinct, best. But passies work, but they're not always helping. So your instinct tells you that to give it, or oh my God, it's working. And it's helping my child. But they're not a developmental milestone. They're not mandatory. And after that 6 month mark, then it's not a SIDS prevention tool or helping prevent SIDS, or that one of the factors there. So beyond that 6 month mark, the cost benefits of using it flips a little bit, and that's when you're talking about craniofacial development and the palate, and they always say, oh, the airways are affected. But what does that even mean? And the way I explain it is that the ceiling of the mouth, the palate, it's the ceiling of the mouth, but it's the floor of the nose. So if you have a passy in this shape, or a thumb in a cylinder shape, then you are shaping your palate around that more narrow object. But if the ceiling of your mouth becomes higher, vaulted, we call it becomes more upwards. But that's the same bone as the floor of your nose. So your nose becomes less. Your nose airway are restricted. They're narrower because your bone went upward. They went in the triangle shape because that corresponds to, it's the same bone here between the nose
Yeah.
and so if it goes like this, then what do you think happens to the nose? So like everything goes up. And that's what I mean by bone development, the maxillary development. So that's
You
where.
guys, I'm having like so many aha moments right now. I'm going to give my own personal story here for my daughter because I just told you she had a pacifier until 5.5. She was always a very anxious child, but
Mm-hmm.
sometimes anxiety can be because they're not sleeping enough. And also, she probably wasn't getting as good of sleep because she's having to focus on that pacifier she's not getting as deep of sleep because she had an airway issue. And I didn't find out until she was 5 that her tonsils were so big that they were impacting her airway.
Mm-hmm.
And when they went in, her adenoids were also giant. So she got all that stuff removed. And so, I found out way later and we thought we were fixing it. But it's funny because it's possible that the pacifier caused a lot of that issue in the first place. It's possible. Here, I'm giving it to her to reduce her anxiety. But there was
Mm-hmm.
another symptom, like that was just a band-aid that I was putting on it. I was like kind of hiding a symptom of what was going on. And like, why is she so anxious? Why isn't she sleeping very well? Well, this is probably just a band-aid that I'm throwing on it. So gosh, this is
Mm-hmm.
just so interesting.
My second biggest takeaway, and I love your perspective on it, is my no shame rule.
Yeah.
It's
No, I don't feel bad.
I know, but a lot of moms are in the same situation as you. I might be talking to a pregnant woman or a mom of a newborn or a mom of a 6-year-old and be like, oops, what did I do? If only I knew before. But
Yeah.
if you've used the passy for longer than planned, if babies or your child is still thumb sucking 4 or 5 years old, then we do with with the information that we had, once we know more, perfect. We guilt free, shame free, move on and find solutions and find the underlying causes of that prolonged thumb sucking. And the
Yeah.
second thing that you reminded me of is um, that anxiety and also ADHD that could happen with that poor oral mouth posture. So if someone sees their child breathing through the mouth, not having that tongue suctioned up, and it could be because of the passy or not because of just they're like that, they're developing like that. Um, but the prolonged use of a passy keeps that tongue down. So if that is the case, if you see a child with open mouth breathing through the mouth, that is not what we want. We want nose breathing. We want the lips closed and we want the tongue suctioned up. And I am repeating myself, but it's very important
Yeah.
because imagine the time a child spends all day, all night breathing through the mouth. But we know that the air is filtered, it's warmed up, it's removed from bacteria, and it offers better oxygen for brain development. But if the air goes through the mouth, it's not warmed up, filtered, without bacteria, and that oxygen over a really long period of time, you can see how it doesn't provide the most optimal oxygen for the most optimal brain development. So that's when we see a big correlation between mouth breathers or prolonged thumb suckers at night because they needed to, or like we said, when they are sleeping, they needed to, but during the day, they're mouth breathers having ADHD, anxiety symptoms that could arise from that brain always lacking the perfect oxygen for all those nights, all those days. So
That's
that reminded
so,
me of that. Isn't that crazy? It's
yeah,
like,
it's really cool because I know we haven't touched on thumb sucking a
mm-hmm,
whole lot yet, but a lot of kids that are thumb suckers do it without even thinking about it. And we say it's because it's a habit, but it could be
mm-hmm,
because they're craving oxygen and the right amount, and they kind of are plugging that space up
to make sure they breathe
because
through the
they're not,
nose.
yeah, so that they can breathe through their nose. So, real quick, one last thing about pacifiers. Are
Yeah.
some pacifiers really better than others and why? Because I know what your favorite one is and you're going to say it, but I know some postpartum doulas that can't stand them because they're like, a baby can't keep it in their mouth.
Correct. I know, I know, I know. So,
Maybe that's why you like it because they don't keep it in their mouth.
and that's my point.
Is that
So,
it?
so the true answer is no passy. The second answer is the best passy is the breast. My third answer is the second best passy is the pinky. And then, of course, if used intentionally, sparingly, then the best passy I'd be most comfortable recommending is the Nini. And I know the PTs in Austin, the OTs in Austin, the IBCLCs in Austin, we kind of all agree. Maybe there's the Philips Studi that has a nice cylinder shape that does promote a nice cupping of the tongue. So again, it's a tool, like what shape will give me what type of training. But so the Nini, it's a collapsible
If you're not watching on
silicone.
YouTube, go watch on YouTube so you can see what she's doing.
It has soft silicone. It has a wider base and a skinnier tip, and it's collapsible. So when baby has the Nini in his or her mouth, you can see the tongue wave, the peristalsis of the tongue.
It's weird.
And then you can see, I know, it's kind of creepy. You can see if the baby's tongue is going all the way to the palate. And if it does, you'll see that it's black at the end. And if it doesn't, then you can literally have a window into their mouth, which you can't do at the breast. You can't do at the bottom. You can't see inside their mouth, but now you can. So that's why we love it so much. And yes, the caveat is that yes, the Nini is a training passy. Therefore, it requires active sucking. Therefore, it will fall out of the mouth if baby's not sucking. So for those car rides and you're in the back seat or you're in the front seat and trying to put the passy back in, please feel free to use ones that might stay in the mouth a little longer. And again, we're all talking about something that's a short amount of time. Even even bad passies, poor passies, poorly shaped passies can be helpful. Just like the one with the bulb at the end here, I have the Dr. Brown. It has
my daughter loved a nook. She loved the nook, or however you say it, and it has a weird shape. But you know what it said on it? Orthodontic pacifier is what it said on it. That was their marketing.
That is just like your bottles episode, where marketing is just they decide whatever they want to say. There's no such thing as a passy that will shape, because it will misshape. It will inevitably misshape past 6 months. So
you know what it is? It's an orthodontic one, so that you have to get orthodontia. That's what it is.
So yeah, the Nini will fall out, but that's the point. Once you're done.
Okay, I can't wait to tell my postpartum doula all about this. I can't wait for her to listen to this episode. That's awesome.
Yes, let me see if I have something else. Oh, the big ones you want to avoid are anything with a lovey at the end, anything that's making the passy even heavier. Please, please, please. I can't even imagine the jaw gymnastics that baby needs to do to keep the weight of that passy in the mouth. And so that one will potentially fall out, but it's too heavy and it might not be as appropriate. So
I always thought that was weird.
There's no good or evil passy. It's again, for lack of repeating myself, it's a tool. You want to use it in certain context. Even a bad passy with the bulb at the end is great for car rides, and that's a few minutes that baby is soothed because that vagus nerve is stimulated by sucking. So
then you've mentioned thumb sucking a few times. Is thumb sucking better, worse, or the same as a pacifier?
So thumb sucking, it has the same mechanism where the thumb is taking the place of the tongue, which should be touching the palate. It's used as a soothing thing or a self-regulating thing, so it's very similar in that way. It's just a little harder to get rid of because
that's the thing. You can't cut off their thumb. Yeah. You can't cut the tip off the thumb like people do on the pacifier.
So the weaning options for thumb sucking, there are many options, and parents know their children best to know which one it is. But the big things I would avoid are any of those spiky appliances, any of the rakes or spikes in the palate. It's like a palate extender, but it has prongs
I've never heard of this. It sounds like some sort of torture.
Some people are still using them because their child is 6 years old and going to school and being bullied for thumb sucking. And so, but if the child is sucking for this long, or at this age, then that means there was an underlying thing. So there's no need to shame your child. The big no-nos I want to say is no shaming, no saying that thumb sucking is for babies and you're past that. And if they are, it's because they need that. And so we need to find solutions for the need, for the cause of the thumb sucking. And so none of those appliances. And if you have been using those, again, my no shame rule.
No shame, no judgment. You didn't know better. We don't know what we don't know. It's okay.
Correct. And
I literally didn't even know that existed. I mean, I think my husband used to suck his thumb, and I think his mom put hot sauce on his thumb. But what's really funny is he loves spicy food to this day. So he was like, I think she just flavored it. And then I think she actually did this thing where she put him in a shirt where like it was long sleeve, and she tied like his hands behind his back to try to get him to stop sucking his thumb.
There are many options there.
But when you hear that it's because they need it, when you hear that, you're like, oh my gosh, like then all of that, like emergent, we've got to stop it, the behavior, the habit goes away, because you're going, oh, this is something that they're using like as a bridge to fix an underlying issue. I think that's such a kind of a beautiful realization, probably. Hopefully that takes a little pressure off of their shoulders.
And it is true that a small percentage of the prolonged thumb sucking is behavioral for about anxiety, or when it comes to that psychological aspect. And that's when those reward charts are helpful, or honestly, quitting cold turkey, or having a little ceremony where you bury the patty and it goes on to whatever ceremonial moment could happen for that smaller proportion of children that just needed it for behavioral purposes, and it's really easy to remove. And so there are options. Just no shaming, no slapping the hand out of the mouth, things like that. It's not the child's fault, and we can just find solutions for it,
Yeah, that makes sense for sure. So at what point what would be a sign to someone that I think you already touched on it a little bit, but it's one of those that bears repeating. What would be the signs that like, okay, we need to see an SLP or like get an evaluation at different ages, if you don't mind?
Yes. So dentists and pediatricians like the 1 or 2 year old mark for thumb sucking. If it's still occasional and it's limited, then they're fine with it. And then if it's past that, or if it's too long, then dentists and other professionals will agree that it needs to be removed. So that's when someone would consult an SLP. The longer you wait, the harder it is to remove, whether you're trying to fix the initial cause, which is orofacial, myofunctional issues that you need treatment for. So the longer you wait, the harder it is to solve whichever way. Even some providers after 3 years, they get worried. At 2 month mark, I can identify oral rest postures and issues with sucking, coordination. When it becomes voluntary at that 3 to 4 month mark, I can identify more factors here. And you might just need 3 sessions with an SLP rather than the 30 sessions program to remove thumb sucking, to address the myo issues. And so some dentists have a cutoff at 3 years old, and some even younger. But if you see some issues that I could list for you, then those are great markers to consult first.
So early intervention makes a big difference on the longevity of the treatment needed.
Beautifully said. Thank you. Summarizing my thoughts.
No, that's great. That makes sense. And I think that it's just like, craniosacral therapy. Like if we did this for babies right after they were born, we could prevent some long-term issues down the road. Gosh, I wish I knew about that when my kid was little, both of my kids were little. Even for myself, I'm like, I wish I had gotten that at a young age. So similarly to this, like my daughter was a a pacifier user. I was a pacifier user. I'm sure that early intervention would have been so helpful. And
so would you be okay if I have just a list of just like...
Do it, girl. Give it to us.
Do it. So in regards to feeding, if you see... So these are all reasons to see an SLP or a myofunctional therapist. So for feeding, if baby struggles to latch at the breast or bottle, IBCLCs can also help with that. If you hear clicking, smacking sounds where the tongue is losing that suction, that's an issue. Frequent loss of suction, milk leaking at the corners of the mouth, feeding consistently for really long periods of time. So like breastfeeding, one feed is 40 minutes plus, and bottle feeding are really effortful for babies. So those are all things that we can help with. That coughing, gagging during feeds, and now again that open mouth posture. So now I'm looking at all those oral motor functions that are not feeding. If you see visible tongue protrusion, those babies open mouth, tongue is out like this. So that's not what we want. That's not the oral rest posture that we're looking for. And we want to tone everything up and make sure the tongue can get up there. For those airway markers, snoring, snorting, noisy breathing, those are all underlying markers that tell me that there's something with the airway. The reliance on thumb sucking, frequent nose congestion, and ear infections. So when you don't swallow properly, that's another episode, but when you're not swallowing properly, when your tongue is not getting up there with enough force, then you're not opening your eustachian tubes between the ears and the rest of the system. And then the ears are not draining. So if you have difficulty sucking, difficulty with the tongue coordination, then you're not draining that ear and see more ear infection. So that's one of the things. And so, yeah. That was my
Once again, I'm like, oh my gosh, my brain is just like on fire because my son got his tonsils out at 2 because he was snoring. And I didn't know he was snoring because I don't sleep in his room. I have a baby monitor, but I couldn't hear it on there. And his preschool teacher, he started preschool in the preschool 2s 2 days a week, just like 3 hours, a social thing. And my friend was his teacher and they had nap time at school. And she was like, hey, it's crazy how much Anson snores. And I was like, what do you mean he's snoring? And she's like, yeah, no other kids are snoring, but he is. And I was like, oh my gosh. And I knew that meant something with his airway. So we got his tonsils removed and his turbinates reduced in his nose. And his turbinates ended up being the biggest part of the issue. But I'm like, he also still, that was when he was 2, he still gets frequent ear infections, even though at 7, you shouldn't be getting those as much. But every time he has allergies, forget it. We're having an ear infection. I just know it. It's coming. And so that makes me think, I'm like, I bet there's something with his palate or his airway that's going on. I'm like, I might need to bring him to Virginie.
After mat leave, I'll be super free.
No, you have to do it now. We in the United States, we have a thing where you are not postpartum anymore. No, I'm just kidding.
Right. Even my baby, he was the cutest snorter. Like, it's so cute. You call him Piggy. Like, even though I knew it was an issue, something to address, it is so cute. But you would never know. Like, he's breathing when he's sleeping and he's snorting, or at the breast taking breaks and then he's snorting. So all of that is how you're using your soft palate, and so I even did have to do a mini treatment plan for my own baby. So there's so many aspects that you can address, and it didn't take long. I did orofacial stuff with my baby, and then 2 weeks later, less snorting. Okay, we're moving somewhere. And then once sucking became voluntary, then baby was having issues coordinating. So I got my ninny, and then you can put your finger in the ninny. So then there's resistance. And then once baby is coordinating, sucking on the passage, you remove your finger, and then they keep going, doing it by themselves. And so I did it, and it's fairly easy-ish when you address it early on and you're diligent about those exercises or treatment plans.
Yeah, every flexibility in children is so much more when they're younger, before everything has just been established. And things, like you said, do become more habit too. Okay, so did we miss anything? Is there anything that I didn't ask you that you want to share? I think we got everything, but I'm just checking.
I think so. I just want to make sure I was nuanced. And
you did great. This was like so helpful.
I want to be strict. Like, some parents need tough love and some parents need nuance. So no patches after 6 months if you want the tough love. And please be aware of the use. Make sure it's occasional and sparingly used.
And you're a great parent.
If it's exactly. So whatever you want to hear, know that.
That is so funny. You are the best. Well, if someone wants, and of course I will put this in the show notes, but if somebody wants to get a hold of you, learn more about working with you, or see more about what you do, how would they find you?
Yes.
After mat leave.
After mat leave. Which starts I'll be back in January 2026. So please reach out then. And also SLPs, very frequently have a free consultation. So if you don't know any of the symptoms, if you don't want to jump in through the whole treatment plan, it's kind of expensive and you don't know if you really need it, please just call us and have a free consult. A lot of SLPs in town offer it, and it gives you peace of mind of, okay, do I really need to jump into something,
Oh, I
or
didn't
is it
know that.
something I
That's
can
cool.
address quickly? And most of us are kind of really willing to help and will tell you straight, like, oh yeah, you need SLP or you don't. So,
That's awesome.
yeah. So the practice is, the website is austinspeechlanguage.com. And we're an infant 0 to 5, practice where we address that feeding, swallowing, speech, early intervention. And then on the website, there's my contact info. So you can email
Wonderful.
me, you can text us.
Well, this has been so much fun, Virginie. Thank you for coming on, even during your mat leave. I kind of feel bad. I didn't realize that we were still on that. So I hope I didn't push your boundaries, but I hope this was fun for you too. And I look forward to talking with you again soon.
Very fun. Thank you. And I hope it wasn't a knowledge dump, and I hope it was enlightening.
Yes, it was enlightening. Thanks. Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.